85, Helen Thomas went on statins about 5 years ago. She has the same issue as millions of Americans, high cholesterol.
I did have, yes. The doctor recommended that I take them. A lot of my friends have been on statins.
Statins proved to be a game changer when it comes to treating cholesterol.
They are the most proven drugs with the most data behind them that show that they actually reduce cardiovascular events by reducing the cholesterol.
Now the rules are changing when it comes to who takes them. New guidelines were recently released by the American College of Cardiology and the American Heart Association.
The previous guidelines had a somewhat difficult algorithm to memorize and to figure out which cholesterol goals were appropriate for which patients. These guidelines try to simplify the process.
For years, doctors prescribed statins based mostly on a patient's cholesterol levels, especially the LDL or bad cholesterol. The new guidelines have a broader focus, looking at a patient's overall risk and then breaking down statin use into 4 categories based on statistics. The first group covers people with pre-existing heart disease. The second, people with significant elevated cholesterol. The third category includes people who are middle-aged with type 2 diabetes. And the fourth group is primary prevention, which is people who don't have cardiovascular disease but are at high risk to within 10 years.
If they're in one of these 4 groups, they should be treated, and then we decide on either more intense or less intense statin therapy rather than targeting a number, which we were doing before.
The number of statin takers under these guidelines will jump from about 15% today to 31%. Doctors hope playing the stats will help people like Helen lower the odds of a heart health crisis.
It's been all right, so it's been normal, within normal range.
For Lee Memorial Health System, I'm Amy Osher.